It really starts with just this context of the world that we're living in right now, where the velocity of change is really extraordinary on every level: technology, demographics, culture, politics, and particularly changes in our economy. The numbers are just not adding up. People can't afford the care we need.
Society as a whole undervalues caregiving. The workforce in caregiving grew 19% in the last 10 years compared to 5% overall for the labor force, so very rapidly growing. 88% of them are female. The education of care workers has increased tremendously over the last 10 years. We're going to need more workers, and yet, the money isn't there to pay them, and so wages are falling. And so much so that about half of women in the field are poor or near poor, less than 200% of the poverty level, and about a third of men in the field are poor and near poor. And that's interesting too, because the women have more education than the men, but men, they get paid more anyway. That's what's happening in childcare. There hasn't been much growth in the childcare workforce. So in many ways, the inability of families to pay for care gives us an underestimate of how much caregiving labor we actually need.
My ability to be here today is actually very much owing to my sister, Chris Sundstrom, who takes care of our dad. This issue, we're going to be talking about policy, we're going to be talking about data. These are important policy issues. They're also very personal issues.
I just say I've always appreciated the challenge of care, but I'm tired. My spouse underwent a valve replacement a couple of months ago, and his recovery has been slower than we ever thought it would be. And I have been dealing directly with the issue of, the home health care agencies, home health care workers, and it has been absolutely stressful. I can't turn this phone off.
And Maya's story, I think, demonstrated perfectly how these kinds of care problems are a real drag on employee engagement and employee productivity. Productivity is another thing people are worrying a lot about. And so are there things we can do to sort of better capture and communicate the huge upside of this kind of an investment in terms of our society? So that's just a question for the panel to think about.
There's such a cultural opportunity here, political policy opportunity, but there's a cultural opportunity here to really transform how we value caregiving in this country and caregiving relationships.
The opportunity to really use this moment to change not just both the value of care, but also this idea that care is very individualistic. And, we have previously been trapped in this sense of like how I care for my child or how you care for your father are very individual decisions that people need to sort of take care of for themselves. And I think this state landscape that's evolving really helps to challenge that notion and bring to light these conversations about care that we are all facing and that are becoming more and more ubiquitous.
In communities around the country, what we found was you start talking to people about elder care and they start talking about child care. You start talking about child care and they talk about paid family leave. And that the experience of all of these issue categories is actually an experience of what it means to live and work and raise a family in the 21st century, that all of these needs and concerns are actually interconnected. What we actually need is a new infrastructure and framework for care. We would have one social insurance program that everyone contributes to, that everyone can benefit from, that helps people afford care and allows for the infusion of resources into our care systems that would help to professionalize and make these care jobs good jobs for the 21st century.
I have a bias about states. Congress never does anything that hasn't been tested and tried at the state level. To me, that's an important step. Having that pathway through the governor's offices, through state policy, and that could be a pretty powerful echo chamber around the country.
We're starting to see our first breakthroughs in elder care. 3 weeks ago, the governor of Hawaii signed into law the Kupuna Caregiver Program. the first of its kind in the country.
The Hawaii legislation is a huge opportunity for us to learn from, to study, to really think about the financing mechanisms, to the political will, what it took, to how we get it to the next step. I would just offer that is an opportunity for us to learn from as we play out this idea of universal family care in other states.
The Hawaii success was huge. We have seen 3 paid family leave laws enacted at the state level in the last 18 months. New York, here in Washington, D.C., huge victory in Washington State a couple of weeks ago, joining California, Rhode Island from Senator Golden's state, and New Jersey. There's a growing body of evidence to lift up.
I think we need to think about the important part that unions have played throughout the 20th century in getting progressive legislation enacted.
I want to just thank you guys for pulling together this conversation and say how much I appreciate tying these different threads together, because I think often, as you talked about, Ijen, if everybody's pushing for their own slice, we are never going to get the whole pie. So I really appreciate bringing the conversation.
Our vision is for this to be the most inclusive as a vision for public policy as possible. So when we say universal, we really do mean universal.
You're freeing up people from doing a lot of care at home to being able to use professional caregivers, and then themselves being able to work more hours or for more of them to work at all.
We are the wealthiest nation in the world. We're at the wealthiest moment in our history. There's no question we can afford all of what we're talking about here. It's a question of values. And I think the American people will be with us and move forward from there.